International Clinical Trials Day is on the 20th of May. To mark this event, the North Thames Clinical Research Network has made this short video to showcase some of the diabetes research that is going on in the North Thames region of London.
In the UK, across Europe and most of the Western world, we are experiencing an obesity epidemic. There's no doubt about that. In the UK, 2/3 of the adult population are either overweight or obese. This has enormous implications for their health and future health care. We're in a situation we simply cannot allow this to continue. We don't have the healthcare resources to be able to manage all the obesity-related disorders that come along with having excess weight. So type 2 diabetes, high blood pressure, hyperlipidemia, mental health issues. Obesity is related to so many health issues that if we don't do something about this epidemic now, we're in a very, very difficult position 10, 15, 20 years down the line.
So what does an at-risk adult look like? Well, these you can screen in different ways. You can use the information collected by GPs, and that then becomes quite simple. So we can look at the body shape of a person. Are they overweight? Or sometimes not particularly overweight, have they got a rather round tummy? Because that also leads to diabetes. Do they have a family history of diabetes, particularly type 2 diabetes? Again, very common in some groups.
Being overweight is absolutely fundamental to the risk for type 2 diabetes. As we gain body weight, we're gaining excess body fat. And it's all the fat that ends up in the circulation which starts to lead to a condition known as insulin resistance. Insulin resistance underpins type 2 diabetes, and the more insulin resistant we become, particularly in skeletal muscle, for example, then that has an effect on blood glucose levels, and that suddenly tips into type 2 diabetes.
So why are we interested in trying to prevent diabetes? Well, we're in the middle of a diabetes epidemic. The centre of this diabetes epidemic is around South Asia. So it's the countries like India, Bangladesh and Pakistan. There the problems are vast. So we now know, for instance, that almost 1 in 4 adults either have diabetes or the early signs of diabetes. Massive problem. Is it contained to just that region? The answer is no. Let's just take Tower Hamlets, where we are at the moment, which is part of East London. Our local Bangladeshi population have a prevalence of type 2 diabetes 4 to 6 times the national average. Not only do we have this vast problem, but it occurs 10 to 15 years earlier than the average population. So what we're doing is we're sitting on a time bomb. So when you're sitting on such a time bomb, you've got to start thinking not how do you treat the disease, but how do you prevent it from happening in the first time?
We know that in many of these cases, many of the people with this pre-diabetic state, in many instances the diabetes can be prevented through lifestyle modification. And that lifestyle modification means modifying what people eat and increasing their physical activity, and if they're overweight, losing some weight. In order to get that message across, most of the programs have involved direct contact between the people with pre-diabetes and experts in diet and experts in physical activity. And as I said earlier, we know this works.
So as I said, the cornerstone to managing type 2 diabetes is weight loss. Now, people find it very, very difficult to lose weight. They find it very difficult to cut back on the total food that they consume across the day. So one approach could be using a meal replacement product. So a meal replacement product would replace one meal. It could be the breakfast or lunch every day. And this has a lower energy content, but it's nutritionally complete. And so people feel that they're getting all of the micronutrients that they require with less energy. The other features of meal replacement products, for example, is that they can be quite filling. They tend to be of a liquid formula, so they can be quite filling for the subject, for the patient, and they feel quite satisfied consuming these products.
The text messaging study was devised as a means of trying to get efficiently information about how to avoid getting type 2 diabetes. We thought that it would be possible to get much of the information and maybe even the motivation required for people to modify their lifestyle using text messages, which can be sent to people very inexpensively and can provide actually a lot of information and a lot of encouragement to people who are trying to modify their lifestyle.
For those of us who are engaged in clinical research and even epidemiological research, it's absolutely vital that we get volunteers to take part in our studies. When it comes to something like type 2 diabetes, we have a very large population group to be able to draw upon. Unfortunately, what we're seeing is that not many people are happy to come forward to take part in some of these studies. My study, in particular, was a meal replacement or a diet study, so it didn't involve any medication, taking any experimental drugs or anything like that. So you would expect that people would be more than happy to take part. Some of the studies actually, require commitment over a long period of time. My study lasted 12 months, and it required the patients to come in every 2 months for a series of measurements, clinical measurements, body composition measurements, and so on.
If someone who has a condition like diabetes is thinking about participating in a research project, then I would really encourage them to do so. I think the only way that we as professionals can ever obtain the information necessary to give people with diabetes or who are at risk of diabetes, the only way we can ever get the information to advise them properly is following clinical studies.
I'd always encourage people to get involved in the research study because they, again, as we've said today, they get more involved with their condition, they learn a lot about the condition, and as well as being a subject or part of the research group, they benefit a lot by really good care while they're taking part in the research.
I think patient and public involvement is so important in research because the researchers are the experts in their own field, but we are experts because we live with the condition and possibly know more about it than they do.
And it actually sort of motivates patients, I think, to take better care of themselves and to get their glucose control perhaps more under control, because of the involvement just motivates you and makes you more passionate about looking after yourself well, so that you can hopefully live longer, healthily, and without the terrible complications of diabetes.
If you are interested in being involved in clinical research, please speak to your GP or contact us directly on the email address shown on the screen.